Okay, this video is why do people stroke? And I could also call this why are old people so stupid? And it's a little bit of a joke, but in America, the average person by 60 is sort of fat, sick, and cognitively slow. They're not demented, but they've lost their nuance, their zip, their vitality, their ability to think quickly. So what it really comes down to is kind of a balancing act. You have this part of the brain here. This is looking at the brain cut from front to back. These are the cerebral ventricles in blue. This is the gray matter ribbon around the periphery of the brain. It's called the cerebral cortex. Cortex means like the bark of a tree. If you like to chop a tree stump down, you'll have the bark as a ring around the periphery, and you have gray matter. That's where the cell bodies are, the nuclei of the individual cells around the periphery. So that's the cerebral cortex. The lighter stuff is called the cerebral white matter. That's where the long tubular part of the neuron is located, the axons that send messages down to the face, the arms, the legs, okay? And this right here, the skull and crossbones, is the watershed area. You've got perforating branches that wrap around the top of the brain, come into the brain parenchyma. You've got perforating branches from below that work their way up. But this spot is a danger zone because you don't have very good collateral flow there. So it doesn't take a lot of vascular disease before you drop blood delivery, blood perfusion to this area, and you get a stroke. All right. The deep nuclei at the level right here, this is the third ventricle, these are the lateral ventricles, so this is called the basal ganglia because they're at the base of the brain. Ganglia means concentrated group of nuclei. At the level of the lateral ventricles, that is called the corona radiata level. Above that is centrum semiovale because it's a central white matter and it's semi-oval shaped. And these are the three major levels of the brain when you're looking at the standard brain pictures that we're going to look at a bunch of them now in a moment. But remember this, we need a Goldilocks balance. And the best way to get the Goldilocks balance is just to, eat the low-fat vegan diet, of course. But that's what it comes down to. Not too much blood supply in the sense of too hypertensive, not too little. And, the best way to regulate that is just give your body what it's designed to have. There's a beautiful painting here by Scott Gustafson. He's the best of the fairy tale artists, magnificent. Okay, so here's what your brain looks like on CAT scan. This is a bunch of hypertensive hemorrhages centrally. These little black dots, they're all small microbleeds, we call them. The microbleeds in the periphery, that is probably in this patient due to hypertensive, but if you only saw the peripheral bleeds, you would think of something called cerebral amyloid angiopathy, CAA, and that's associated with so-called Alzheimer's. I really think it's primarily a hypertensive problem, atherosclerosis, vascular disease problem, and diabetes-related problem. I'll explain why that is, but classically in a book that'll be described cerebral amyloid angiopathy. And I see a couple of these every day. I see a bunch of these every day, these hypertensive little hemorrhagic lacunar infarcts centrally every day. I see a bunch of them every day. And I usually see a couple patients with cerebral amyloid angiopathy every day. Super common stuff. Now here's a bigger bleed. This is a basal ganglia bleed. We're at the level of third ventricle, and it's a big focal intraparenchymal hemorrhage. Those are rare. I only see one once every 4 months. They're uncommon. I look at many thousands of brain MRIs. Yeah, they happen, but they're uncommon. People talk about them a lot, but they don't happen that much. This stuff happens all day long, every day. Okay, now here is a tale of two brains. Here is a normal-looking brain, small ventricles. You don't see any big white spots. These big white spots are silent strokes typically, or minor strokes, okay? You have a little normal hyperintensity in the corticospinal tracts, but that's just normal. You have a little bit of hyperintensity in the gray matter ribbon. That's all normal. It has more blood supply. There's more fat in the deep white matter. The brain is up tight against the skull. It's a tight brain, a young brain. Okay, when you get an older person, there's more atrophy. The sulci are dilated, so you got more cerebral spinal fluid around the periphery. Okay, these are both brain MRIs. All these white spots are stroke, and this is what I mean by you could have 100 strokes in one patient. A bunch of little tiny strokes, and eventually they kind of add up together. They become coalescent. And so if it's touching the ventricle, we call it juxtaventricular. If it's near the ventricle but not touching it, we call it periventricular. If it's near the cerebral cortex out here, we call that subcortical. And because we're at the level of the lateral ventricles, that's corona radiata. So bilateral corona radiata, extensive, perivascular, juxtacortical, and subcortical, flare hyperintensity. This is a flare sequence, meaning that fluid is bright, but the CSF is suppressed. Okay. So anyways, this is a typical crappy looking brain. Okay, this is actually worse than average for an 80-year-old. This would be a bad looking 80-year-old. And don't get me wrong, I see a bunch of these all the time. But this would be like a bad 80-year-old, even a bad 90-year-old. This would be like a perfect 40-year-old. Okay, but I do see a lot of old people that look like this still. So it's possible to look like that. Okay, here's like where big strokes often come from. Big strokes often come from something like atrial fibrillation, where a large clot is formed in the left atrial appendage and it gets tossed up to the brain. Boom, big stroke, right middle cerebral artery. You can always tell what's right and what's left as if you walk into the room and the patient's feet are towards you. Okay, so this would be the patient's right, this would be the left, because you're imagining that their feet are pointing towards you. So AFib is one of the major causes of big strokes. So here would be a big acute middle cerebral artery stroke, right frontal lobe, okay, and then this is diffusion weighted imaging. It becomes positive very quickly with a stroke. This is ADC, another MRI sequence, and when DWI is hyperintense, ADC is hypo, low signal, that meaning dark. This is bright, like white. That's called restricted diffusion. That means acute infarct, okay. This becomes positive immediately, all right. This doesn't become positive until 6 hours, so you can even time the stroke, okay. So this is you know that it happened like 6 hours ago at least, because flare is positive, okay? But it's probably, less than 6 or 7 days because you still got restricted diffusion. All right, so now we're going to start getting into some more interesting stuff, but I got to give you all this background info so the other things I say will make sense. So here'd be a big middle cerebral artery infarct, like the one from that AFib. They tossed a big clot up to the middle cerebral artery, supplies this part of the brain, big stroke. This patient's at high risk to die and be severely debilitated. You got midline shift across the midline. The mass effect is pushing the frontal horns, the lateral ventricles across the midline. So that patient has midline shift. This is called the falx. So to go beneath the falx is called subfalcine. So that's subfalcine brain herniation. Very bad. Here's another old, typically cognitive slower demented patient with lots of hypointensity. Normally the white matter should be a little higher in density. This is a CT scan. These are both CT scans. The ventricles are big. They're atrophied. Atrophy of brain parenchyma. The vents expand. That would be called, let's just call it ventriculomegaly ex vacuo, into the atrophied brain space. All right, I'm going to get to some more interesting stuff. Just had to go through all this background. Here would be like a typical demented brain I see. There's no stroke. There's no bleed. All I see is a shrunken brain. And this is a CAT scan, expansion of the cerebral spinal fluid space in front, kind of big cell size filled up with cerebral spinal fluid. Okay, here would be like an example of a normal brain on the right side, and here's a shrunken brain on the left side. You can see the cerebral parenchyma is sort of collapsed downward. This would be all filled in with cerebral spinal fluid. The lateral ventricle is bigger on this side, on the left side, than on the right side. The temporal horn of the lateral ventricle is small, normal over here. It's big over here. Hippocampus is a little bit shrunken on this side. This would be a typical demented brain. The point is that most of the time I see atrophy, not strokes. Okay. We talked before about the dilatory theory. You tied off the carotid artery in a mouse. 2 months later, middle-aged and older mice are demented. Autopsies, doesn't see a big stroke. He just sees a shrunken atrophic brain on that side. So chronic undersupply of blood causes brain shrinkage on side. I'm going to get to some new stuff. If you heard me say this before, I will go into some new stuff, I promise you. But I had to go through this basic stuff just to get everybody listening up to speed. Okay, lots of things are mouse equivalents. Anything that drops the perfusion to the brain in a significant way can be like a mouse equivalent to having that artery tied off. The dilatory theory of dementia, or hypoperfusion, meaning lack of blood supply. Atrial fibrillation, you drop your atrial filling 25%, you get decreased blood to the brain. Diffusely, it's going to be both sides. Congestive heart failure, you don't got good pumping pressure to the brain, you drop your pressure. Why do you have a blood pressure? To get blood to the top of your brain, the cerebral cortex, pumping it against gravity. Okay. Sleep apnea, hypoxia can damage your brain. Diabetes, you can have hypoglycemia, causes other problems too. We won't get into that in this lecture. I got other lectures like Does Diabetes Make You Stupid? Overtreated hypertension. You overtreat the hypertension, you get less blood supply to the brain. That's why it's so dangerous to treat hypertension with drugs, okay? Sometimes, yes, the patient benefits, but it's also dangerous. You could drop that pressure too low. That's what's the great thing about food. We're sort of made to have our blood pressure regulated by eating a healthy diet, and that system is better designed than than drug-making companies are designed. Okay, carotid stenosis, yeah, it's not that common. Aortic stenosis or regurg can happen, does happen plenty. Post-CABG, coronary artery bypass graft, open heart surgery, hypotension, that's a relatively significant common thing after cardiac surgery. There's a few other things, but we'll leave it at that for now. Okay, same diagram. If the blood pressure is too high, you'll have a tendency to get small little lacunar infarction. A lacuna is a hole. So you get a little hole in here, a little bit of bleeding. That's a typical lacunar infarction due to hypertension. All those little microbleeds I showed on that earlier MRI, one of the first images I showed of the brain today, those are all hypertension-related microhemorrhages due to shearing off a tiny little branch of these arteries. They're called lenticulostriates, okay? And then the big white spots up here that I showed on that one case, that's all due to lack of perfusion of this segment. Quite often because, one of these reasons, you're hypotensive or your blood is thick and you're not perfusing those segments adequately. Another thing that happens is you can get deposition of beta amyloid over here. So here's a normal looking artery, here's a normal looking vein. You got the lining cells, single cell thick of the endothelial layer. We're still in an artery here, we're not in a capillary yet. You'll have smooth muscle cells around it, you'll have some collagen supporting it, and you'll have a perivascular space. This would be like in your penetrating arteries where they penetrate into the brain tissue, the brain parenchyma. Okay, in the vein, you also have a little bit of a collagen wall, but you don't have all the smooth muscle. Okay. Now, why does beta amyloid deposit there? Well, one of the things I'm going to tell you is if you have insulin resistance, the enzyme that clears insulin out of the blood is called insulin-degrading enzyme. When you have insulin resistance, the pancreas makes more insulin-degrading enzyme because there's higher insulin levels in the blood. But that insulin-degrading enzyme has an affinity very high to insulin, to clear insulin out of the blood, but can only be made in fixed quantities. And it also has a second job. It clears beta amyloid protein from the blood in the periphery, meaning outside the brain. So when you have chronically high insulin levels, that means you don't have enough insulin-degrading enzyme to clear out all your beta amyloid, and it starts to go backwards back into the brain. And when that's a chronic, prolonged thing, like for decades, it'll start accumulating in the walls of the artery. So that's beta amyloid protein deposition in the walls of the artery, and it weakens the walls of the artery, and it damages the endothelial cells and the smooth muscle cells. And then you can start getting little microbleeds related to that. Okay, and this is also related to hypertension. You can also get similar problems in the vein. You can get thickening of the collagen level in the vein, the collagen layer in the vein, and that is called venous collagenesis. Venous collagenesis, and that can narrow the diameter of the vein, which can cause some similar problems, okay? It can lead to a little bit of venous intracranial hypertension because you can't get the blood out of the vein as effectively, okay? And you can also get microbleeds related to this, and you'll deposit beta amyloid protein around there. In addition, you'll get expansion of the perivascular space. There's cerebrospinal fluid space that runs circumferential along the arteries and the veins. And that'll tend to get expanded when you have a lot of venous collagenesis. And this is associated with ischemic cerebral vascular disease due to lack of blood flow, lack of oxygen delivered to the tissues. It's also associated with multiple sclerosis. And when you start getting into understanding disease in a sophisticated way, you see that there's quite often multiple simultaneous things causing brain damage. And these diseases are not so specifically discrete and separate from each other as you'll initially have thought when you first heard of them. So I'm going to get into some interesting stuff. And now we're moving into interesting territory, stuff that I haven't spoke about before in one talk altogether. Okay? And so here's a more complex diagram, kind of like I drew that last picture of the skull and crossbones from this paper here called The Etiology of Cerebral Small Vessel Disease and Vascular Dementia. All right, so this is just showing that big hemorrhage, big interparenchymal hemorrhage like the one I showed earlier on a CAT scan that was actually on the right side. These are the little microhemorrhages, cerebral microbleeds in the basal ganglia from hypertension. These are little lacunar infarction. Lacunar means a hole from these lenticulostriates being occluded, often due to hypertension-related vascular disease. We just think of these as hypertension. Okay, you can get a hemorrhage higher up in the brain parenchyma, but that's rare. Yeah, I sometimes see it from cerebral amyloid angiopathy. And of course, I worry about a tumor. Is that a metastatic tumor that bled? Okay, so we always investigate for that. Get a CAT scan, chest, abdomen, and pelvis, rule out, lung cancer primate, rule out renal cell carcinoma, that sort of thing. But these are rare. These are rare. this other stuff, these microbleeds. I see them all day long, every day. And then the most common thing I see is little infarcts here, like I showed you that one patient that had like over 100 little bright spots, unidentified bright objects, UBOs. We usually just call them, the way we describe them is because the sequence of the brain was flare, the MRI sequence. We call them flare hyperintensities. That's how we always call them. But what do I think they are? I think they're typically silent strokes, or strokes with only mild symptoms. But you get enough of them, it's like popping rivets off an airplane. Eventually the airplane don't work so well. Uncle Joe's moving kind of slow at the junction. That was the old TV show when I was a kid, Petticoat Junction. All right, so anyways, these are some cortical infarcts, so along the periphery of the brain. But right in that area along the ventricles that I was sort of showing you before, that's where you get most of your infarcts. And these things all add up to make the patient cognitively impaired and demented. Okay, another thing is, what's the deal with hypertension? We talked about that before. The big two well-known things are high-fat diets causing blood sludge, number one. Number two, high-sodium diets causing vasoconstriction concurrently with the lack of plant potassium, magnesium, nitric oxide precursor. But the third thing, of course, was, like I talked about, leaky gut, fiber deficiency, leading to all that abnormal clotting, amyloid clotting, netosis-related clotting, and elevated white blood cell count pushing the big white cells through the capillary. Those are the three major causes of hypertension, along, of course, with stress. But here's another thing. We talked about before, the Wing-Kessel effect. After decades of being hypertension, you just lose the elastic fibers in the ascending thoracic aorta. You can't get them back after maturity, so you have a stiff ascending thoracic aorta. Normally, the aorta ascending thoracic aorta is stretched outward during contraction of the left ventricle, cardiac systole. Systole means contraction in Greek. And so that stretches it outward. Then there's elastic recall doing diastole. Diastole means relaxation of the left ventricle. And then the ascending thoracic aorta, it generates a pumping pressure. So it's like a second heart. But once you trashed all the elastic fibers, you lost that. And that means that in order to get the same amount of blood to the brain, systolic pressure has to go up. And diastolic pressure is going to be lower. So now you get a wide pulse pressure. Pulse pressure is the difference between the top number and the bottom number on your blood pressure. And the wider that pulse pressure, the more likely you're going to have almost like a water hammer effect that's going to damage your arteries a little bit at bifurcation points. So this is another reason why you always want to try to fix a problem as soon as you can, because it's harder for your body later on. Okay, so this is just showing, milk, dairy is the most common thing associated with multiple sclerosis, most common thing associated with type 1 diabetes. Here's one paper about it. Antibody cross-reactivity between myelin, oligodendrocyte, glycoprotein, and milk protein, butyrophilin, in MS. Okay, so there's a milk protein, butyrophilin, that the antibodies to that, they cross-react with the myelin to cause demyelinating lesions, like of multiple sclerosis. Okay, here's something similar, about autoantibody cross-reaction between casein, okay, and myelin protein. So you get MS. The characteristic lesions of MS are a little more perpendicular relative to the vein. Those are called Dawson's fingers is the terminology of it. And that's right along the venules, the veins that run perpendicular to the lateral ventricle body. Okay, so the reason I showed you that is because I want to talk a little bit about Roy Swank. Roy Swank was friends with Dr. McDougall, and he did a lot of research about blood sludge and blood flow. Some of his papers, he followed a lot of his patients for 34 years. And about the ones that were treated early, they had like 95% of them with no symptoms on long-term follow-up of MS, okay? The ones who didn't follow his treatment, they often just died. They had terrible symptoms and died. A lot of them crashed and burned. So here's what he's saying here too. The greatest benefit was seen in those with minimum disability at the start of their diagnosis. 95% survived and remained physically active. So his patients were doing great at 35 years, much better than the patients treated with all those fancy, expensive drugs. I can tell you though, most people, in my experience, most patients are pretty stupid. Here's what I see how like the typical patient thinks. Well, who's the expert? Well, the expert in MS is a neurologist. The expert in autoimmune disease is, a rheumatologist. The expert in hypertension is going to be like the internist. And what I'm trying to say is, they don't understand. Conventional medicine is based on selling drugs. It's not based on curing patients. No one cares. If you cure the patient, you lose money. So what I mean by that is, the typical ignoramus patient says, I'm going to go to the specialist, the authority in my field. But they don't understand. They're an authority in making money for their medical practice. They're not an authority in knowing your disease, okay? So for that reason, you missed the chance. If you read the papers of Roy Swank, he had by far the best cure rate. He's kind of like what Esselstyn is to coronary artery disease. Why wouldn't you want that? Okay, and the reason is they're too lazy to read and learn, because I've had people, they know me. They know how smart I am, okay? And their family members freak out and go, oh no, I'm going to the expert. I know what I'm doing. I'm going to the expert. Yeah, have fun, pal. Have fun going bankrupt and with a treatment that doesn't even work. Okay, here's a paper written about the role of hypoxia in this lesion. So this guy, I just wanted to point out this paper is not written by Swank, but they came to the same conclusion, that hypoxia plays a role in the periventricular lesions of multiple sclerosis. That the hypoxia from the blood sludge is damaging the arteries, and then it's causing defects in the blood-brain barrier, and these autoantibodies can then get into the brain parenchyma. Okay, so that's relevant. This is Dr. McDougall with Dr. Roy Swank. Roy Swank was Harvard MD, PhD, genius researcher who figured out a mechanism for multiple sclerosis through blood sludge due especially to saturated fat, and that causing hypoxic damage to the blood-brain barrier, and that allowing the autoantibodies to get access to the brain parenchyma, and it was most damaging in the periventricular regions, perpendicular to the periventricular regions. We'll call those Dawson fingers. Okay, here's some stuff from research done by Roy Swank, and there's a video of this at Dr. McDougall's YouTube channel, Dr. McDougall Medical Center YouTube channel, and it's only about 50 seconds long. So here it is: blood sludge, blood flow before and after eating a fatty meal. Okay, it's only 50 seconds long. You see the red blood cells flowing independently initially, and then after the high-fat meal, they're all stuck together in a Rouleau formation or blood sludge. And here's one of the papers by Roy Swank to the same effect, that once you eat the high-fat meal, they stick together. Rouleau formation means stack of coins in French. You get clumping of the red blood cells, and when they're clumped up, they don't deliver oxygen as well, and that can cause tissue hypoxia, and that can damage the blood-brain barrier. And I'm going to get into some interesting things about that, okay? Swank initially didn't think the cooking oils were so bad, but later research showed they were quite bad. In their own way, they were as bad as the sat fat. That had been studied by others. I'm going to come to their paper in a moment, Meyer Friedman and Ray Rosenman, for example. Swank had measured in hamsters after a high-fat meal a 30% drop in oxygen delivery to brain tissue. So it can be a big deal. You superimpose on that, caffeine can drop blood flow up to 25%. So a high-fat meal with caffeine, and then vasoconstricted with a lot of sodium, like let's say you have a pizza with a lot of salt, and you're drinking a caffeinated soda pop or coffee, you're dropping blood flow to the brain a pretty significant amount. If you already have baseline atherosclerosis from diabetes, hypertension, etc., then you're pushing your luck. Okay, so here's Dr. Swank's paper, and the more the patients drank milk, that means the more sat fat intake they had, etc., the worse their multiple sclerosis got. So he severely restricted saturated fat intake. Okay, here's one of Dr. Swank's papers about aggregation of red blood cells, impairing blood flow, intravascular aggregation and adhesiveness of the blood elements associated with elementary, dietary lipemia. Okay, so this is chylomicron curve in hamsters. So basically, when the chylomicrons are the mechanism of absorbing fat when it first comes from our gut into the blood and it travels around. And these are relatively big particles, and they cause the blood to sludge. Triglycerides cause the blood to sludge. Saturated fat causes the blood to sludge. Cooking oils cause the blood to sludge. That's important because it makes the blood thicker, less able to deliver oxygen. Here is a picture. And, Peter Quo studied things, especially with sat fat in the 1950s, and he was followed by Meyer Friedman and Ray Rosenman using cooking oils, because there were initially some irrational exuberance with the idea that omega-6s would be good. But they found out the omega-6 cooking oils, the PUFAs, polyunsaturated fatty acids, caused an even more prolonged sludging of the blood. Quo had shown that the sat fat, so what he did was he fed the patients a high-fat meal, checked their blood lipids every 30 minutes, and these were cardiac angina patients. They would tend to get cardiac angina episodes right at peak lipemia, around 5 hours. And there would be, incidence of symptomatology, let's say about 3 to 7 hours, okay? Whereas when they fed sat fat, that even more prolonged sludging of the blood. and they could measure their cholesterol level, their triglyceride level, and whatnot as it was going on. He was a cardiologist from Pennsylvania in the 1950s, Peter Quo. Meyer Friedman or A. Rosenman, ophthalmologist. Okay, here's just a paper showing triglyceride in plasma. When triglyceride goes up, you get increased rouleau formation, decreased oxygen delivered to the tissues. The rate of rouleau formation was increased with the increase in triglyceride concentration. And this prevents homogeneous tissue oxygenation. Yeah, it's bad. You drop oxygen delivered to the tissues. Okay, here's another paper. Whole blood viscosity, meaning how thick the blood is. Viscosity is thickness. In metabolic syndrome related to diabetes, sort of like prediabetes, with type 2 diabetes. And what they found is the worse the diabetes, the worse the metabolic syndrome, the more triglycerides in the blood, all these things led to thicker blood, more blood sludging, higher blood viscosity. So that's all increasing the risk of atherosclerosis and tissue ischemia, meaning undersupply of oxygen. Here's another paper, this one from 2016. Blood-brain barrier failure as a core mechanism in cerebral small vessel disease and dementia. So what this paper showed was around every white matter hyperintensity, in a sense, it's kind of like the idea of a penumbra. Penumbra means like let's say, it means that you have, let's say my fist is the dead brain. And then around it you have surrounding brain. Here, I'll show you, I'll make myself a little bigger here. So let's say my fist is dead brain. That's the core infarct of dead brain. And then around it you have surrounding tissue that's not dead, but it's dysfunctional. That's called the penumbra. Penumbra means twilight in Greek. So that surrounding tissue, it's not dead, but it's at risk to die very soon. So if you optimize all the blood flow and avoid head trauma and all that kind of stuff, you might save the penumbra and have that return to normal. And what they're basically saying is all that tissue around the little stroke, like all those, like 101 patient I showed you of the flare hyperintensity, small asymptomatic or minimally symptomatic strokes, that brain is at high risk to be damaged. And that's what their study showed. They developed a sensitive way to check for blood-brain barrier leakage by injecting, contrast material at MRI with these really sensitive machines. And it's very subtle, but they're catching some leak of the contrast into the brain parenchyma. And that is highest right around those baseline flare hyperintensity, small strokes. The farther you go, the less likely you're to have that. But the point is, remember, leaky gut simultaneously means that you got leaky brain because they're both dependent on the butyrate from the dietary fiber made out of the dietary fiber by the good gut bacteria made into butyrate, short-chain fatty acid, 4 carbons. That protects your gut lining, your gut barrier, but it also protects your blood-brain barrier. So what I'm saying is, if you've got leaky blood-brain barrier, lots of patients have it. I see tons and tons of those small, silent, minimally symptomatic strokes every day. Tons of them, hundreds of them. Okay, so the average person over 60 has at least one of them. Okay, don't get me wrong, I see plenty of people who don't have any, but the average person has a couple. So that means they've got leaky blood-brain barrier all around that little stroke they had previously. So they're at risk for these toxins from the gut, like LPS, bacterial endotoxin, et cetera, to get into their brain parenchyma and then have the microglia activated, start releasing chemicals to so-called sterilize the area because of the LPS, bacterial endotoxin, getting up into the brain parenchyma, causing neuroinflammation, damaging the collateral brain tissue that's in the way. When they bind the LPS, bacterial endotoxin, they think there's a bacterial attack upon the brain, so they want to sterilize the area. They release all these toxic chemicals. And then the brain cells in the vicinity of that are damaged. So the reason why this is fascinating, and I've been interested in vascular disease, cerebral vascular disease in the brain for a long time, is because what he's basically saying here is there's a big overlap between the lesions of MS and just plain old garden variety strokes that we see thousands of, okay? I'll see, maybe a couple hundred regular patients for every MS patient I see. And maybe about 100 regular patients for every MS patient, 100 stroke patients for every MS patient, something like that. Okay, so anyways, this injury to the blood-brain barrier is just garden variety common problem with tissue hypoxia due to blood sludge, okay? When you superimpose upon it autoantibodies, then you get MS with demyelination, periventricular regions, Dawson's fingers, and all that. But what they're saying here is blood-brain barrier failure is a core mechanism. Core meaning fundamental to cerebral small vessel disease and dementia. It's much, much more common. Okay, so why should you care? If you're sitting there thinking to yourself, why does this guy go on and on? Is he just, an annoying blowhard? No. I know exactly what I'm talking about because there's a lot of gut toxins that now have free access to the brain, and the person's at high risk to be trapped into a vicious cycle and crash and burn, which is what I see most people do. They just going down the tubes, keep taking more and more pills, getting surgeries, demented, dead. That's the usual outcome I see in an older patient. That's sort of the Western way of sort of, handling old people. And what I'm saying is, what you want to do is fix your diet, get your sleep, avoid your stress, avoid all the bad foods. So MSG, monosodium glutamate, MFG, manufacturer-free glutamate, when you got leaky gut and you have excessive amounts of those, some of that's getting into your blood. And if you got all this blood-brain barrier leaks, it's getting into your brain parenchyma all over the place. You don't want that. It's an excitotoxin. Same thing with aspartame, same thing with glyphosate. Okay, same thing with beta amyloid protein, all this stuff. This paper is basically just saying, look, we don't just find a little bit of blood-brain barrier leakage in old people. We're finding it all over the place. The blood-brain barrier has a huge surface area. A slight decline in barrier function could result in neurotoxins, such as beta amyloid protein, getting into the brain. Some blood-brain barrier integrity declines with normal aging. Okay? And blood-brain barrier failure can occur for multiple reasons, including injury by hypertension, injury by diabetes, injury by neuroinflammation, cigarette smoking, increased dietary sodium intake can worsen the blood-brain barrier. All of these will damage the vascular endothelium, the lining cells. Okay. Hypoperfusion, underperfusion of the brain from overtreated hypertension, for example, atrial fibrillation, congestive heart failure, etc., can trigger blood-brain barrier failure. Okay. When you see a white matter hyperintensity, that should sound an alarm bell that you need to get your act together so you don't get more of them. And I can tell you, in my experience, they're so common that doctors will often just write in the chart or talk to the patient. They'll tell them, look, this is normal aging. Because in the United States, it is normal aging. I expect the patient to have a couple little strokes by the time they're 60 in the USA. I'll bet if I scanned my brain, there wouldn't be any. But I don't need to scan because I know it's working good. You don't go scanning stuff for the heck of it, but because you might find something you don't want to find that's just an annoyance, an incidental oma, then you're stuck following it up. It's a pain in the butt. All right, so anyways, that should sound alarm bells. And people should try to improve endothelial function and reduce blood-brain barrier leak to avoid permanent injury. Okay, yeah, that's what you want to do. That's the smart thing to do. Okay, here's a paper of Meyer Freeman and Ray Rosenman. This is from a Dr. McDougall lecture. And they were the two ophthalmologists, and what they showed was that when you feed people high-fat meals, they would see these little blood vessels. Here's before and here's after. The vessels would shrink, and you would often see very little flow going through these vessels. And this is a real high-fat meal. So it looks like it's especially saturated fat, given there's bacon and there's milk and there's cream and there's butter. Oxygen PO2 delivery was decreased by 20%. So here's the paper. You can look it up for yourself. Friedman, Meyer Friedman, Journal of Circulation, 1964. Okay. So this is just one more example of things that cause blood sludge. Okay, this is the same old idea that, red blood cells about 7 microns, capillaries 5 microns, has to deform to fit through there. When you got blood sludging, you stuck the red blood cells together because there's some type of bridging molecule sticking them together. That's rouleau formation, stack of coins. Now you're pushing a submarine sandwich through these capillaries. Instead of individual red blood cells, pressure has to go up. Okay, you can see the fat in the blood. This is like from the movie Game Changers. They had a nice scene with that. It makes your blood thick, a big kind of greasy mess. Okay, red blood cells have a negative charge on their outer surface. That's called a zeta potential. Things that are big enough and positively charged will stick the red blood cells together. That's called a bridging molecule. They overcome the zeta potential. IgM antibodies will do it. LDL cholesterol will do it. Fibrinogen, the clotting protein, will do it. Uric acid will do it. Okay, fibrinogen normally has a alpha helix cylindrical shape, but in the context of bacterial endotoxins from leaky gut getting into the blood, it'll change to a flat configuration. That's called beta-pleated sheet as a secondary protein structure. Those will stick to each other, make a big aggregate, and then it'll precipitate out a solution. When the molecular weight gets too high, in aqueous solution, water solution of the body, normal plasma, it'll precipitate. That means to clot. The higher the LDL cholesterol, the higher the blood viscosity. And HDL does the opposite. HDL tends to push the red blood cells away from each other and prevent them from clotting. Dr. Gregory Sloop says because the LDL was positively charged and big enough size, it could overcome the zeta potential and make them stick together. I read his paper about that, and that was discussed in his book, and I spoke to him personally, and that's what he told me. Okay, and then, like I said, other people have shown blood sludge effects, like all of Roy Swank's work, especially from saturated fat, and then there's all the papers showing it from triglycerides, etc. And then there's the Douglas Calathoresi Pretorius paper showing it from amyloid clotting related to bacterial endotoxin LPS for gram-negative bacteria, bacterial endotoxin LTA for gram-positive bacteria, and also for excess free iron, okay, because that causes ferrous redox cycling between Fe2 plus Fe3 plus Fe2 plus Fe3 plus, giving off electrons that lead to reactive oxygen species, ROS, which then also damage the fibrinogen, the blood clotting protein, and cause amyloid clotting, distorted abnormal clots. They call it dense matter deposits. Okay, here's one of Gregory Sloop's papers, the effect of low-density lipoprotein, LDL, and HDL on blood viscosity. LDL would increase blood viscosity because it's sticking red blood cells together. HDL would decrease it because it's pushing them apart. Okay, so here's the red blood cells stuck together. Normally blood flow is kind of a parabolic velocity profile. Red cells in the center flowing fastest, white blood cells on the periphery, and then plasma on the side. When you have normally the blood pressure hits a median divider. You come up to bifurcation, let's say in the neck. Common carotid artery bifurcates into the external carotid going to the face, internal carotid going up to the brain. It bounces off this median divider. So at normal blood pressure, that's no big deal. But at high blood pressures, there's an excessive amount of turbulent flow after bouncing off the median divider and an excessive amount of retrograde flow. Too much retrograde flow, too much turbulent flow confuses the endothelial lining cells. They got little sensors that sense the direction of flow. And so when it's abnormal, they actually start to express prothrombotic molecules on their cell surface. And that can cause adhesion of red blood cells and white blood cells and clot formation. Okay, and that's why you'll almost always see early atherosclerotic plaque. Atherosclerosis and blood clot are the same thing. Opposite the median divider, right here on this wall, the internal carotid artery. I see that every day. Okay, normally, this is how they're spindle-shaped along the long axis of flow, the endothelial cells lining the arteries. The endothelial cells lining the artery, the most important thing they do is they make nitric oxide, a gas, diffuses into the lumen, and it causes the platelets not to clot. It blocks them from becoming activated towards clotting. It diffuses into the wall of the vessel, into the smooth muscle, and causes them to vasodilate. So that's what the great nitric oxide does. The glycocalyx, glycoproteins on the surface of an endothelial cell, also they're antithrombotic because of their negative charge, their zeta potential, especially from heparin sulfates. And there's also something attached to them, antithrombin 3, that's also antithrombotic. They make tissue plasminogen activator, antithrombotic. Okay, we talked about the McDougall movie about, the Roy Swank movie at Dr. McDougall's YouTube channel about blood flow. We talked about that, and the Roy Swank paper to that effect. And this is just showing that over time what happens is, from the chronic diabetes, you're going to get thickening of your capillary basement membrane, the yellow membrane around the endothelial cells. These are endothelial cells, spindle-shaped with a little nucleus there. These are red blood cells traveling through a capillary. The little blue circles are oxygen being delivered to the tissues, the axon in the brain in this case. The green cells are the vascular smooth muscle around the periphery of the arterial or capillary, in the brain, pericytes, they're called. They have a special name, peri, sites, C-Y-T-E-S. Okay, so here's thickening of the capillary basement membrane, the yellow stuff. Here's hypertrophy and hyperplasia, increased number of the vascular smooth muscles. So as the arterial wall gets thicker, sometimes it'll be like fibrotic tissue in there, collagenous, fibrous tissue. You're going to get decreased oxygen delivered to the tissue. So chronic hypertension and diabetes damage the arteries, thicken the walls, and lead to decreased oxygen delivered to the tissues. Then you superimpose on that high-fat meals, sodium vasoconstriction, caffeine vasoconstriction. You're dropping your blood supply to your brain. You don't want to do that. And most people are totally oblivious to all this. So they keep on doing it every day, day after day for decades. And then all of a sudden, they're just stupid, and they don't know why they're so mentally slow. And no doctor can really tell them. and they don't know what happened, and it's just the way it is. Isn't it sad? Grandma or grandpa isn't that with it, losing their marbles. Okay, and so the good news is once you understand it's primarily due to all this vascular disease, you can avoid that. And I've given much more detailed talks on dementia. My recent talk, if you go to Vegan Society of Hawaii, I recently gave one about dementia to get you up to date on everything. Plus, I've talked about these things a lot on lectures over at VegSource where I go through all the way that food damages the brain. But the point for our purposes, we're focusing on atherosclerosis and hypertension. Basically, diabetes and hypertension are the gateway diseases that damage the brain. And it really is, you could even call this a plant deficiency, because that's what it is, Dr. McDougall, T. Colin Campbell, and others have said, about 70 to 80% of disease could be prevented if people would just eat a low-fat vegan diet with no oil. Okay, so anyways, here's the beta amyloid protein being deposited, and then that starts widening the perivascular space, and then accumulates a beta amyloid in there too. That can interrupt the glymphatic system a little bit, the brain's cleaning system that runs at night. And so you get all these things cycling in the wrong way. That's why you want to get your act together. The older you get, the more fragile you get, so you got to get your act together so you avoid the progression of these problems. Because otherwise you just get in the vicious cycle and everything progressively gets worse and worse. So when you get venous collagenoses, thickening of the wall of the veins, let me show you, I just had that on the previous slide. So the collagen in the wall of the vein around the lumen where the blood flows gets thickened. That's called venous collagenoses. Venous collagenoses. That can plug up some of these little veins or increase their, narrow their diameter so you get back pressure. And then you can get expansion of the perivascular space. There's a pressure on it and it will expand. So these little white spots are cerebrospinal fluid filled spots around, for example, the ventricular striate arteries coming up from the middle cerebral artery M1 segment. And you'll see more and more of these, and that's basically the brain's trying to compensate for the vascular disease, one of the major mechanisms of causing that. And it's associated with cognitive decline, worsening cognitive performance. And you can see there's some T2 hyperintensities in there, high signal bright spots. This is a T2 sequence rather than a flare because the fluid in the cerebrospinal fluid and the lateral ventricles and along the cortical sulci, it's hyperintense, it's bright. Whereas in a flare sequence, it's suppressed. But both of them get hyperintense, small strokes in the deep white matter. Okay, so this would be corona radiata because we're at the level of the lateral ventricles. We're above the lateral ventricles here, so this is the level of the centrum semiovale, which we talked about earlier. And this is just showing, detailed views of these dilated perivascular spaces, which contain cerebral spinal fluid and accompany the arteries when they penetrate into the brain, and then when they exit from the brain, the veins. So anyways, venous collagenoses increases these spaces, and it's a vascular disease risk factor, and it messes with the glymphatic system. So now when you look at this diagram, everything makes a lot more sense. Hypertensive lacunar infarcts in the basal ganglia, rarely hypertensive hemorrhages in the basal ganglia. Okay, lobar hemorrhages rarely from cerebral amyloid angiopathy, which a lot of times I think is just really hypertension. But they're super rare to get them in that location. These deep infarcts, these are what are common right here. That's what I see every day, all day long, tons and hundreds of them. Every day I'll see hundreds and hundreds of them. Cortical infarcts are less common. Yeah, they're common, but they're nowhere near as common as this stuff. Okay. Oh yeah, and if you got leak, you get, like I said, you get bacterial endotoxins, LPS from gram-negatives, LTA from gram-positives. And the same patients are often free iron overloaded. Most men in the Western country are iron overloaded in their late 20s. Women, when they're postmenopausal, within about 10 years or less after they stop menstruating, they're usually iron overloaded. Because all the food tends to be iron fortified, and they also eat a lot of meat typically. This is redox cycling, ferrous redox cycling. So if you got excessive free iron, like Eugene Weinberg, he was an iron scientist, he said, iron is like fire. You want it in your fireplace, you want it in your stove, you don't want it anywhere else in your house or it burns stuff up. And that's what free iron is. When it gets away from its binding proteins like ferritin, intracellular, transferrin in the blood, it'll start to cycle back and forth between Fe2 plus, Fe3 plus and give off electrons to oxygen. And those will run what is called the Fenton reaction and produce these free radicals, reactive oxygen species, that will damage tissue in a lot of different ways, including the fibrinogen proteins in the blood, change it from alpha helix to beta pleated sheet, just like the LPS and the LTA bacterial endotoxins would do. And then you get that amyloid clotting stuff. I gave entire lectures on that before. I'm just letting you know, all these things cycle in the wrong way. So that's pretty much what it comes down to. And so, like, the bad news is, for the typical old person, there's about 20 different things simultaneously going on, destroying their brains. And then what's the good news? The good news is, this is all knowable, and you just avoid it. Be a minimalist. Avoid all these personal care products, toxic chemicals, things that smell bad, and just, eat the low-fat, low-sodium vegan diet with no oils. I recommend organic only a single ingredient on every food, because if they put a second ingredient in it, they can add stuff in like MSG, MFG, and all that kind of stuff. Always low fat, no smoking, no MJ. I recommend no alcohol. I mean, one drop is not a big deal, but it's just best to avoid it. Okay. I don't add salt to my food. If you add a little bit of salt to outside of your food, that's okay. So anyways, and avoid things that smell bad, just because most things that smell bad are bad for you. If something smells good, then it's probably good for you. Okay, but if it smells bad, it's probably bad for you. I just say that because quite often those things that smell bad are volatile organic chemicals like paints and glues and stuff, liquid paper and all that. And those are associated with containing like trichloroethylene, for example, or other things that are circuit inhibitors. Your calcium pump to decrease cytoplasm calcium in your brain, so that your cells can become overactivated in the presence of those chemicals. So anyways, I hope that was helpful. It's just a little bit of insight into what causes cerebral vascular disease and what causes the ubiquitous small strokes in old people in Western countries.